Good afternoon to you. Yeah, we're deeply concerned about the unequal rollout of vaccinations globally. Our survey shows that where vaccinations have started, it is overwhelmingly in high-income countries. Nearly 90% of the countries where vaccinations have started are high income, but where it hasn't started are in lower and lower middle income countries, really noticeably in Africa, but also Central Asia and Southeast Asia as well. Now, the World Health Organization have set this declaration for vaccine equity. They've said they want to see all countries having started the rollout of vaccinations at the beginning of April. We absolutely support that. It really importantly concentrates and focuses minds. But from what we're seeing at the moment, we think that there is a serious risk that that target won't be hit. And that's a huge worry in terms of the world defeating this virus.
So, Mr. Catton, what type of timelines are we looking at here? We see here from the research that out of the countries that were surveyed, like 8 of them or 9 of them, none of them had actually started with the rollout. And these are in low to middle income countries. Do we have any sort of dates as to when these rollouts of vaccines for healthcare workers will actually begin?
Very little for Africa. Many of the countries just don't know when their rollout program is going to start. Some do, and it might be in April or May, but the lack of knowledge, the lack of understanding, the lack of a timeline is in itself really worrying. And it's worrying because our nurses and healthcare workers around the globe are continuing to get infected with this virus. We now know, tragically, more than 2,700 nurses have died as a result of contracting coronavirus. So we have to do this to vaccinate them, to protect them. But we also know that without healthcare workers, we have no health systems. So there's also the case to vaccinate to ensure we protect our health systems. And what we know as well, you know this very well from Africa, is that the virus is mutating. It's becoming more highly transmissible. The real race here is not a country by country or even a continent by continent, but the race is a global one for us to vaccinate more quickly than the virus mutates. And at the moment, we're worried that we're not winning that race.
You spoke there about the concerns surrounding the new variant. Have you perhaps also looked at how healthcare workers, specifically nurses, are viewing the vaccination? Are they keen to be part of vaccination programs? Are they optimistic about the impact and the effectivity of vaccines on them?
Around the world, it's nurses who are absolutely at the forefront of managing and leading the rollout of vaccination programs, and are the health profession who most often will be the person who is putting that jab in your arm. They're also the people who see the consequences and the effects of this virus on people who get sick and get very, very sick. Nurses had huge psychological pressures they've been under because of this, the number of people who have been dying and becoming very unwell, nurses who've had to step in where relatives are unable to be there as well. And nurses will provide information and advice about the vaccine. If people are unsure about it, if they have worries, concerns, or hesitancy about it, nurses can help with providing those explanations. It is vital, though, that we prioritize nurses and health workers. And by that, I do mean that we would like to see nurses, health workers in low-income countries vaccinated before younger, less vulnerable people in high-income countries.
Awareness has been raised. The World Health Organization has spoken about this, the dangers of vaccine nationalism. But beyond the rhetoric, what are the steps that are being taken by perhaps organizations such as yourself to move from talk to action?
And that's the critical piece. We need to see action. At the moment, we have some countries who have ordered more vaccines than they have people. We need to see greater sharing of vaccines. There are some countries who are doing bilateral deals and not working through the global initiative COVAX, which has been set up to share and ensure rollout of vaccinations right around the world. We need to see more vaccines manufactured. And that means that those companies who have led the way with vaccines, working with others to enable us to speed up the manufacture of vaccines as well. But then we need to see countries put in place the practical steps and measures to vaccinate people. I've heard some leaders who've said that this is in the hands of God. It's not. This is in the hands of us as human beings, as health leaders, as political leaders as well, to make sure that not only have we got the vaccine, but then we've put in place the clinics and the rollout, the logistics to move the vaccine, the lorries, the staff, the health education, to make sure that we vaccinate people everywhere.
Are poorer countries, is the African continent solely then in the hands of the haves, of the first world countries, their leadership to decide when and if they're going to be giving the continent any of the vaccines?
What is clear to us is that the impact of this virus is global, it's worldwide. You can't isolate yourself as a single country from the impacts of coronavirus. We've seen countries who've even moved to try and lock down their borders, that the virus has still managed to find a way to enter, even if high-income countries think we've vaccinated all of our people, but then there's a further mutation and a further mutation in another country that will escape the vaccine. That is a worry for us everywhere. We also know that our economies around the world are intimately connected and intertwined, and our economic prosperity, again, isn't dependent on what we do as one single country, but as continents and as the world together. We won't win this fight on a nation-by-nation basis. We will win it as one world. And those, I think, are the arguments that need to be put clearly in front of all political leaders as to why they must act in solidarity.
Mr. Catton, thank you so much for your insight this afternoon as we focus on the vaccination of healthcare workers.